I'm going to tell you something. If you see a care home nurse, like a nurse that work in the care home, and this person sits for nclex and pass it, one sitting and all, you really need to applaud that nurse. I'm going to tell you this firsthand. Based on my experience of preparing and writing the nclex as a nurse that have never worked in the NHS in the 3 years I've been here. You know, in the care home, we manage elderly patients or people with learning disability, people with dementia. For it's more or less not like the hospital setting where you come across many cases. I used to say this to someone: if it take an ICU nurse just 30% input to study for nclex to pass, it's going to take a regular ward nurse about 50% input in their study to pass the nclex. A care home nurse, if you don't put 80 to 90% to study and understand, you're going to fail the nclex. That is the truth. Especially if you've been away from practice in the critical or acute setting and you're working in the care home like me. Imagine things like the ECG. When I was reading for the nclex, that was my main issue. When I see the graph, I can't differentiate sinus tachycardia. I don't know how to differentiate to start the point. The only one I know is asystole, because it's just like a straight line. You see things like ventricular fibrillation, how to differentiate it, how to differentiate atrial fibrillation and the rest. As a care home nurse, nobody have ever brought ECG to me to interpret, or neither have I seen it be done. I've not even done an ECG for any patient before. So my advice, if you are a care home nurse, you really need to know what works for you. As for that ECG or EKG, whatever people call it, you understand, it's better for you to check some videos on YouTube and study alongside your U-word or your Archer review. Because if you stick to just the one in the U-word, it's concise, but for the fact that you are a care home nurse, you're not used to this thing, you're not used to the foundation, so you need to go see like a video that they break it down for you. And when you've watched that video, you can now catch up to the U-word question method for those ECG and the EKG and the rest, because it will be very hard for you to interpret those graphs. It's going to look like a film. I don't know how to say it.